is the stem cell therapy?
Okay, so stem cell therapy is the treatment that we use the stem cells to give it back to the patient. So the source of stem cells can be either from the patient himself or herself, or from outside of that source.
What is the difference between immune cell therapy and stem cell therapy?
So immune cell therapy, the treatment will focus on the work of the immune cells. For example, if you have weak immune cells, especially cancer patients, then you need to boost their immunity. So you use the immune cells that works for immunity. But stem cells, it doesn't specify its function on the immunity, so it can help with rejuvenation and repair that the patients may need.
What is the difference between autologous stem cell therapy and cord blood stem cell therapy?
So autologous stem cells, you can get autologous cells, meaning it comes from your own body from many sources. So the well-known one is from the bone marrow, but that type of stem cell will be only useful if you have blood diseases. The other type of stem cell is like widely used from adipose tissue and dental root pulp, but the easier one to harvest is the adipose tissue. But the limitation of your own stem cell is that because it is old, its age is already old, is equal to your age, so its ability to help even rejuvenation may be limited. When compared to the umbilical cord derived stem cells, those umbilical cords are from the babies, right? So the age of those stem cells are still very young, and it has like potency to work or to multiply in numbers or to send out signals that are useful for rejuvenation. So if the patient is of advanced age group, we would recommend that you use the umbilical cord one.
What kind of main purpose do your patient receive stem cell therapy in here?
Okay, so there are many purposes and many indications. Most of the time, the way that we see the disease in our patient is that it comes with aging. So when you become older, even though your body has stem cells with inside, but those stem cells, they have limited ability to work, to repair itself, or to help you stay young and healthy. So in many cases that we see that, okay, it's clearly because your own stem cells are not working, we would recommend stem cells. So those diseases include neurological degenerations like dementia, Alzheimer's, or even depression, or some psychological issues that may be linked to aging, and there are cases where we fail with other therapy, like we add nutrients which fix their hormones, but still they don't recover the way that we expect. So we would suspect that it's because their stem cells are not working, so we would recommend stem cells.
Have you any cases from your patient have any side effect of the stem cell therapy?
So far, no. Very little. I would say that very little. Some would experience like mild fever, but that resolved like within 24 hours. We heard from other clinics that say some of their patients experience like a shortness of breath, but that lasts also only like
For a short time.
So basically it is very safe, and the allergy issue is not encountered at all. Also infection after the infusion of stem cell never occur.
Which kind of stem cell is the most efficient for anti-aging therapy?
Okay, so when you consider stem cell therapy as an anti-aging method, I would recommend that we use the umbilical cord. And the reason why, first of all, it's because of its safety. Safety as in it doesn't lead to developments of cancer. Because in the previous time with the experiment with embryogenic stem cells from the embryo, that leads to certain kind of tumors. So umbilical cord derived stem cell is very safe in that aspect. And also because it is from the umbilical cord, which is the organ that support the growth of the baby inside the uterus. So the cell itself has a very potent ability to support the rejuvenation and also the repair of old and non-functioning cells. So the mechanism of action is that it also sends out signals in exosome to tell our own stem cells what to do. So basically it boosts up the rejuvenation and the healing. So that works much better than the autologous stem cell that you get from your own body, because they are old and they are not working. That is why you have all the health issue, right? So that is why we need the babies, there's umbilical cords that has the ability to rejuvenate itself to help us.
Or two example for your last patient had the best result after stem cell therapy treatment.
Had a patient who suffered from depression, and she was on many medications which didn't help her much. So we discussed about using stem cells. Her psychiatrist didn't have any objection, so we start her on the stem cell therapy, and it seems to help her in terms of the cognitive functions, and also the need for the medication seems to be less. So I think it works because depression is now understood to be the inflammation in the brain. The other case are for the general rejuvenation. So we have a very old patients who feel very sick easily, and we don't know what else to give him because hormone doesn't work, or IV nutrition doesn't seem to work much, so we give the stem cells, and that seems to help the body kind of reboost and then more receptive of the treatment that we give him. Lastly, it is not directly my patients, but it's the patients of other doctors that I know. He treated the young child with autistics, and he had that child. He also had some issue with the body regulation of temperature. So he would have a high fever, and then he would seize, and that happens very often. And the medication that is used to suppress the seizure just doesn't seem to work well. So he get experimented on the stem cell therapy using the umbilical cord one, and then after that treatment, only I think a week, the seizure stopped, and he didn't have the kind of the fever that goes up and down like that.
Oh,
before.
just 1 week.
Just 1 week, and only one session.
ADSC cell and then UCMSC. If we inject IV same amount of the cell, the efficient is how much different? Roughly.
If you inject the same amount, I would have to say that adipose tissue derived stem cell work. It is not as strong, because if you want the same results, you may need a lot more for the adipose tissue cells. So maybe 10 or even to some 100 times
really?
The number. Yeah.
Oh, okay.
Yeah. And there are studies that shows that. So so I would recommend that if you want to harvest your own stem cells, first you have to undergo the liposuction, which is painful and harmful,
yes.
right? Why don't you consider the umbilical cord, which is safer?